Good afternoon, everyone. I'm Dr. Divya Lakshmi and Associate Professor in the Department of Ophthalmology. We have had few sessions in the past where we discussed about conditions like diabetic retinopathy, glaucoma, and common conditions that we see in children. And we also discussed about computer vision syndrome and all. Today, I'll be highlighting few points about a common refractive error called as myopia. Myopia, as we all know, is the name for what we call it as short-sightedness. So it's a common condition or a refractive error where person suffering from myopia will find it difficult to see far objects. They can see the near objects little more better when compared to far, which is correctable with certain lenses, called as the lenses which were used for correcting myopia. It could be in the form of spectacles or it could be in the form of contact lenses as well. There are two types of myopia. A simple myopia, where the power is around, say, less than around 6 diopters, or pathological myopia or high myopia, where the power is more than 6 diopters. What we see commonly is a simple myopia, which is correctable with spectacles, or we can use contact lenses to correct this form of myopia. Or there are other methods to correct a simple myopia, like you would have heard about laser procedures or LASIK procedures, where it is possible for a person to get freedom from glasses, where the correction is done, surgical correction is done to correct myopia. But this is the one which is commonly seen. The simple myopia is the one which is commonly seen. Pathological myopia is a condition where the power in the eye is more than 6 diopters. We do see it in the normal population. Here, in addition to this, they have some pathology in the eye. Why is it called pathological? Because there may be some changes seen in the retina which needs treatment. Because if it is not treated, it can lead to some complications at a later date, like the detachment of the retina, where the retina gets separated from its attachment and can cause sudden diminution of vision, sudden drop in vision. All patients who are having myopia need to undergo a retinal evaluation. Whenever they visit an ophthalmologist always stresses about the need for evaluating the retina for the same reason. The evaluation of the retina is compulsory to look for any of these changes in the eye, in the retina, which can lead on to a condition like retinal detachment at a later date. If such a lesion is formed, then it needs correction in the form of laser. I'll stress again, all myopes have to undergo retinal examination for to look for those weak areas of in the retina which needs treatment. Because if it is detected prophylactically, we can treat with laser and prevent the complications that can happen because of it at a later date. And it is also a condition which can progress. If we see myopia in a child, the child needs repeated evaluation every yearly or once in 6 months or 1 year, once in a year, at least once in 2 years, because there is always a possibility of a progression of the condition. A child having -1 diopters may progress on to have -2 diopter of myopia. So they need a repeated evaluation at a regular or frequent intervals. And during these intervals, if the myopia is progressing rapidly, if it is moving on to the high myopia side, ophthalmologists will definitely ask for an examination of the retina for the reasons as mentioned earlier. So I would like to stress at this point that the regular follow-up is needed for all myopes for detection of progression. And secondly, regular follow-up needed for evaluation of the retina. So how do we, is there any possibility to prevent onset of myopia? It is unlikely because of our lifestyle, because of the genetic inheritance of the people. It may not be possible to prevent the onset of myopia, but we can always prevent the further progression by encouraging kids to engage themselves in more of outdoor activities, because studies have shown that more of indoor activities and more of near work can cause progression of myopia. So what we can do maximum is encourage the kids to engage themselves in more of outdoor activities and to avoid near work as much as possible. And early detection is possible because of screening. There are many, even the government has taken up certain programs like school screening programs to detect refractive errors in school-going children. So, and if the child is complaining of defective distribution, it is mandatory that they have to undergo an evaluation to look for any refractive error and then get it corrected with the corrected glasses. And yes, treatment is possible. All myopes can be treated with spectacles or contact lenses. And surgical correction is advised only after a particular age, that is, say, after the age of 20-21 years, because it is not done at, even earlier than that. The main criteria being the stabilization of the refractive error. If it is progressing, then the surgical correction cannot be done. If the progression halts at a particular point of time, then after a year or so, surgical correction can be planned. So more than 21 years, if the myopia becomes stable, then we can plan for the refractive surgery, that is LASIK procedure. So to conclude, I would like to say myopia is a common refractive error which is seen in our population. You may see like every third person moving around with glasses, and the most common refractive error is myopia in our population. And there are a simple myopia and a pathological type. The simple myopia is simple, just correction with glasses should be adequate. But people may have some pathology in the retina which needs evaluation at regular intervals. If any pathology is noted, if any condition is noted which can harm the individual at a later date, that has to be treated by prophylactic laser. Encourage children to do more of outdoor activities to prevent further progression of myopia in children.